Hi there, and thanks for your interest in Philadelphia American Life Insurance Company, or PORLIC for short. This company was founded in 1924, with the current management taking over in 1989. PORLIC is headquartered in Houston, Texas, with a BBB++ rating by AM Best. Our aim during this video is to introduce you to and help you make sense of this policy. Current major medical plans have been a staple for most Americans for many years. However, their costs have increased greatly since the emergence of the ACA. The major reason for the cost increase is the 10 essential health benefits, or EHBs, that must be embedded in all major medical plans. 8 of these benefits are included in some way in the PORLIC plan. They are hospitalization, prescription drugs, emergency services, laboratory services, ambulatory patient services, rehab and facilitative services and devices, preventative, wellness and chronic disease management, and mental health, substance abuse and behavioural health. The PORLIC plan has some form of these ACA benefits. However, the PORLIC plan does not have maternity and newborn care or paediatric dental and vision care. While these benefits are great for young consumers, they aren't a necessity for everybody and contribute significantly to the cost of a policy. Therefore, we would advise that if maternity is something that may be needed in the near future, you may be better suited to purchasing an ACA plan. The PORLIC plan can include dental insurance with a vision discount program in a separate policy and may already be included in your quotation. Also, all ACA plans must have no pre-existing conditions limitations, unlimited coverage, no copays for routine physicals. Each one of these benefits is great for the consumer, however it does increase the cost of a policy. As an example, with a no pre-existing conditions limitations clause embedded in every ACA policy, a person can sign up for an ACA plan in the hospital in the middle of December. In this example, the major medical policy must start paying the hospital bill on January 1st before receiving their first payment from the policyholder. You can imagine the additional costs this could add to an ACA policy. The Health Saver Plus 3 or HSPIII policy keeps costs under control. It is a high-end, defined benefit, fixed indemnity plan and not a major medical insurance plan. Fixed indemnity benefits are provided for hospital confinement, specified medical, surgical and outpatient events. These benefits are paid in specific amounts and do not provide expense reimbursement for charges based on your healthcare provider's bill. Now, here is a medical plan comparison. With a major medical plan such as BCBS or Humana, their plan pays based on the expense incurred. The deductible is applied against eligible expenses before the insurance starts to pay. With this high-end hospital indemnity plan, the plan pays based on the defined benefit schedule, very similar to Medicare. The deductible is applied against the eligible benefits. Here's an example of how deductibles are applied under a hospital indemnity plan. The deductible is applied against eligible benefits and not eligible expenses. It's simple. Add up the reimbursement for all eligible benefits and subtract the selected deductible. It's that easy. Here's a practical example. In this example, we use eligible benefits based on 3 units. The definition of a unit is a category of benefits with a specific dollar value. There is a total of 3 groups or columns of benefits associated with specific dollar values. Group or column 3, also known as 3 units, is the richest with the highest dollar value. Once you have signed on to a column, you will keep the dollar value associated with that unit of benefits. Here is a 3-day hospital stay for an injury which pays $6,000 a day. $6,000 times 3 days equals an $18,000 benefit. The surgeon is paid $4,954.65. The anesthesiologist receives 25% of the surgeon's fee, or $1,238.66. Therefore, the total eligible benefit in this example adds up to $24,193.31. Unlike a major medical plan, we subtract the $2,500 deductible last. We add the total benefits, then subtract the deductible. What we are left with is the total benefit paid, which is $21,693.31. This is what Porlick pays out, not what the hospital charged. Porlick will always pay the total benefit amount. Therefore, if the hospital charges $18,000, Porlick will pay the hospital's charge of $18,000 and the policyholder will receive a cheque for the difference. $3,693.31. On the other hand, if the hospital charges $24,000, which is $2,306.69 more than Porlick will pay, the policyholder would owe the hospital the difference. Moving forward, the main purpose of this presentation is to educate policyholders on how to keep medical costs below what the hospital charges by using the multi-plan PHCS PPO network. Now, let's see what's in the policy. The key features of the HSPIII policy includes the following. A $5 million lifetime maximum limit per policy. You may choose from 3 benefit options. You pick your base plan deductible. You pick your calendar year benefit maximum level. You get to choose the number of benefit units to fit your needs. In addition, you can use any doctor or hospital you choose or select from the large PHCS PPO network of doctors and hospitals to take advantage of greater savings. Most doctors participate in this PPO network. You have the option of 5 calendar year deductibles. You may pick one of the following deductibles: $100, $500, $1,000, $2,500, or a $5,000 deductible. This plan lets you choose calendar year maximum benefits per calendar year. The most commonly chosen benefit is the $250,000 per calendar year option. However, if you require more calendar year benefits, you may choose the $1 million benefit option. So, think of the annual maximum benefit as being a bucket of money you purchased. Each time you have an eligible medical expense, money comes out of the bucket to help pay those expenses based on the benefit plan selected. Every year, Philadelphia American refills the bucket. This only means that at the beginning of the year, January 1st, Porlick maintains a minimum balance of your chosen calendar year benefit. In this example, it would be $250,000. When you receive services at the hospital, you have an itemized bill. This bill will include a facility fee, which is the hospital's costs, and a service fee, which includes the costs for professional medical personnel such as the surgeon, assistant surgeon, and anesthesiologist. This page addresses only the facility fees of the HSPIII policy. Remember, the definition of a unit is a column of benefits. Once you have selected the number of units that fit your needs, you will remain in that column. We will focus on 2 units for this example. For a hospital confinement, meaning you're admitted and stay overnight in a hospital, for 2 units, the plan will pay $3,000 per day for a sickness and $6,000 per day for an injury. For 2 units, with the hospital intensive care unit confinement, the plan will pay the daily benefit selected of $4,500 per day for a sickness, and $6,000 per day for an injury for a 20-day period. On the 21st day, this benefit converts back into the hospital confinement benefit of $3,000 per day for a sickness, but stays the same at $6,000 per day for an accident. For mental illness, alcohol, and/or substance abuse, the indemnity benefits are stacked. With 2 units, the plan will pay $400 per day plus the hospital confinement benefit of $3,000 per day, bringing a total daily benefit to $3,400 per day. When using the rehabilitation and skilled nursing facility indemnity benefit for 2 units, the indemnity benefits are stacked. With 2 units, the plan will pay a daily benefit amount of $1,500 per day plus the hospital confinement benefit of $3,000 per day. This brings the total benefit to $4,500 per day. When a covered person receives treatment for outpatient radiation or chemotherapy when confronted with cancer for 2 units, the plan will pay $1,500 per day. Finally, for an outpatient hospital or ambulatory surgical centre, the plan will pay the daily indemnity benefit selected for outpatient hospital or ambulatory surgical centre services when surgery is performed as a result of a covered injury or sickness. The calendar year policy deductible will be waived for the first claim incurred in a calendar year for each covered person when surgery is performed under general anaesthesia. For 2 units, the benefit pays $3,000. As mentioned before, professional services such as surgeon, assistant surgeon, and anaesthesiologist fees are itemised and billed separately. This page addresses the professional medical services performed in a hospital. For surgical benefits, the plan will pay the daily surgical indemnity benefit if a covered person undergoes a surgical procedure when performed in a hospital or an ambulatory surgical centre due to an eligible injury or sickness. When the surgical procedure is performed in an outpatient hospital or ambulatory surgical centre, the deductible will be waived for the first claim incurred in a calendar year for each covered person, when surgery is performed under general anaesthesia. The reimbursement schedule for 1 unit for surgical benefits is similar to what is payable under the Medicare Physician Fee Schedule for surgeries. This is also known as the Resource-Based Relative Value Scale, or RBRVS, which is used to determine how much money medical providers should be paid. For inpatient pathologist and/or radiologist services, the plan will pay the daily indemnity benefit if any covered person undergoes an inpatient pathologist and/or radiologist procedure as a result of a covered injury or sickness. The reimbursement schedule for 1 unit is similar to what is payable under the Medicare Physician's Fee Schedule for surgeries. This benefit, Physician's Care Indemnity Benefit non-surgical, is paid for each visit a covered person receives from a physician while confined. For 2 units, the benefit pays $100. The Daily Assistant Surgeon Surgical Services Indemnity Benefit for covered services pays 20% of the eligible surgical benefit. The Daily Anaesthesia Indemnity Benefit for covered persons pays 25% of the eligible surgical benefit. This page is dedicated to outpatient benefits such as doctor's office visits, lab work, x-rays, prescription drugs, and urgent care. The HSPIII has 2 deductibles, one for inpatient care and the other for outpatient non-surgical care. For outpatient non-surgical care, there is a $50 deductible applied to testing, lab work, urgent care, etc. However, for doctor's office visits only, the deductible is waived for the first 3 visits and applied only to the 4th visit in a calendar year. This deductible is not waived for other outpatient benefits such as CAT scans, prescription drugs, and emergency or urgent care. Keep in mind, the indemnity benefits shown on this page are what the insurance company pays. These are not copays. As an example, let's say the average price to see a doctor in your area is $120 per visit. When you stay in the multi-plan PHCS PPO network, you will receive their pre-negotiated price. This means you receive a substantial discount. In some instances, the reduction is between 40 and 50%. When you present your card to the doctor's office, if given a discount of 50%, this will reduce your cost to the value of the indemnity benefit $60. As a result, if you have chosen the 2-unit benefit column, you will owe nothing at the doctor's office. If, on the other hand, the pre-negotiated price is $80 and the indemnity benefit is $60, then the policy owner will pay the $20 difference. At the same time, if the pre-negotiated price is $50, then the doctor will receive $50 and the policy owner will receive $10. Remember, this plan always pays the benefit amount to someone, even if there is another insurance policy acting as the primary for the insured. For other outpatient benefits, the deductible is applied immediately to the first visit. The HSPIII plan will pay the following when purchasing the 2-unit indemnity benefit. For MRI, CAT scans, or nuclear testing, the plan pays $350. For other diagnostic testing or X-rays, the plan pays $80. These 2 benefits are enhanced tremendously for accident benefits when paired with the Enhanced Accident Expense Plan, which is included in most quotes. We will review this later on in the presentation. For laboratory testing, the plan pays $20. And for injections, the plan pays $10. The daily generic prescription indemnity benefit is $10 for 2 units. The brand name prescription indemnity benefit is $20 for 2 units. The prescription drug benefit is the only benefit that is reimbursed. It would be more convenient to file claim forms every 6 to 12 months as opposed to each time a prescription is bought. The emergency room benefit has a limit of 1 use per calendar year and pays $200 for 2 units. The urgent care centre benefit has a limit of 1 use per calendar year and pays $100 for 2 units. The preventative care indemnity benefit starts 60 days after the effective date and is limited to 1 benefit per covered person per calendar year. This benefit is not subject to the calendar year deductible or pre-existing conditions exclusions. This benefit includes things like mammograms, pap smears, colonoscopies, etc. This benefit pays $125 per calendar year. The emergency ambulance indemnity benefit is limited to 2 benefit payments. 1 benefit payment for ground transportation, which is $500, and 1 benefit payment for air transportation, which is $1,500. These benefits are increased substantially for accidents which will be presented later in this presentation via the Enhanced Accident Expense Plan, already priced into your premium. To enhance your benefit options, Paulick has added riders that can be bought separately that increase the indemnity benefits for preventative care, outpatient urgent, and emergency care. The preventative care rider gives additional coverage for the daily outpatient physician's indemnity benefit, the daily laboratory indemnity benefit, and increases the preventative care indemnity benefits specifically for mammograms and colonoscopies. The preventative care benefits with this rider is limited to 1 benefit per covered person per calendar year. Consult your brochure for details. Also, Paulick has increased the outpatient urgent and emergency care indemnity benefits substantially. They have added separate indemnity benefits for the facility and the physician's daily medical treatment, thereby making sure they are paid separately. The urgent and emergency care benefits with this rider is limited to 1 benefit per covered person per calendar year. Consult your brochure for details. In addition, the outpatient urgent and emergency care indemnity benefit rider also includes an accidental death benefit of $50,000. The proceeds of which are paid to the beneficiary upon receipt of due proof that the death of the covered person is directly caused by accidental bodily injury. When you qualify for an HSPIII policy, the plan covers pre-existing conditions after 12 months of continuous coverage on the plan. So, let's define a pre-existing condition. A condition for which treatment was rendered or recommended by a physician or for which drugs or medicine was prescribed within 12 months prior to a covered person's effective date and will not be covered for the following 12-month period. Maternity is considered a pre-existing condition no matter when the pregnancy occurred. However, if the pregnancy is induced because of a medically necessary procedure authorised by a doctor, it will be considered an illness and the expense is covered. It is important to note that pre-existing conditions applies to all benefits with the exception of the preventative care benefit. Repricing is still available through the multi-plan PHCS PPO network. The rest of the presentation on the HSPIII policy will be devoted to the multi-plan PHCS PPO network. While you can use any doctor or hospital you choose without penalty, you have the option of accessing the PHCS network to take advantage of great savings at no additional costs. The advice here is always use the multi-plan PHCS PPO network when possible to get costs below what the policy pays. Here's how network benefits will work when using the HSPIII indemnity plan. Number 1. The policy will present the Paulick ID card at the time of service. Again, Paulick stands for Philadelphia American Life Insurance Company. Number 2. The doctor or hospital will verify coverage based on information on the card. Number 3. Charges will be forwarded to the National Claims Clearinghouse. Number 4. The National Claims Clearinghouse will electronically forward information through the Electronic Commerce Operations Management Line, ECOM for short, who will reprice the claim. Number 5. ECOM will reprice the claim and send it electronically into Paulick's claim system. Number 6. The PPO discount will be shown on the Explanation of Benefits, or EOB, that is sent along with the claim payment to the provider of service. Benefit payments in most cases are sent directly to the participating provider. Number 7. If the HSP3 policy pays more than the billed charges but less than the PPO discount or allowable charge, POLIC will send the provider the PPO allowable amount and reimburse the policyholder the difference. Now, let's look at a couple of repriced claims. Here is an explanation of benefits from a provider in Tyler, Texas for a metacarpal fracture. This is a broken bone in the hand. As you can see, we have the line items, the date of service, and the CPT codes. CPT stands for Current Procedural Terminology Codes that signal to the doctor or hospital the amount a procedure should cost. Each procedure has a CPT code with an associated charge. The column titled Charge is what the hospital would have charged had the procedure not been repriced in the multi-plan PHCS PPO network. PHCS stands for Private Healthcare Systems. Quick note here, Multiplan bought the PHCS network in October of 2006 to become one of the nation's largest private healthcare networks. Next, we have the number of days in the hospital and then the allowable charge. The allowable charge is what the Multiplan PHCS PPO network will allow the provider to charge as a member of PHCS. As you can see, the allowable charges are considerably less than the associated CPT code sticker price. In fact, the allowable charge has a $5,749 savings, or a 57% discount off the sticker price. Next, we have 2 examples of an actual 3-day hospital stay for prostate cancer with a $1,000 deductible using the HSPIII policy. The first example on the left uses 3 units, which has a daily hospital benefit of $4,500 per day. As you can see in the second column, we have CPT codes next to the associated expense. The expense column is what the hospital charges and not what the plan will pay. The total expense for a 3-day hospital stay before using the PHCS network is $24,848.89. The eligible benefit, which is what the plan pays, is $22,383.04. The plan will always pay the assigned benefit amount, regardless of the network or other insurances used. Now we subtract our $1,000 deductible last, and we have a payment amount of $3,545.85 that the policyholder owes to the hospital. Now, let's stay in the PHCS network to take advantage of the savings. As you can see, the hospital bill has been repriced by 40%, leaving a total expense of $14,909.33. Now let's apply the eligible benefit and subtract our deductible last. What do you have? Now you receive an eligible benefit going to you of $6,393.71. In other words, you walk out of the hospital with cash. Next, using the same hospital PPO discount expense of $14,909.33 and applying 2 units as an eligible benefit, we have a total eligible benefit of $14,868.70. Now we subtract our $1,000 deductible last, and we are left with an out-of-pocket expense of $1,040.63. Compare these out-of-pocket expenses to a major medical plan. Remember, with a major medical plan, you will pay your deductible first. In many cases, your deductible may be $6,000 or more. This would be your out-of-pocket expense before coinsurance kicks in. Next, we see the Multiplan PHCS PPO network search engine as it would appear online. Here you can search to see if your doctor is in the network in advance before having a procedure. Next, we have the number of facilities and physicians, along with the discounts of the PHCS network in several cities in the US. This spreadsheet has a summary date of April 2016. The rates, providers and facilities charges may have varied slightly from April of 2016, but overall they have stayed near the same. Let's review this chart for Dallas. The number of acute facilities in Dallas, Texas is 74. The number of ancillary facilities in Dallas is 1,341. The number of primary care physicians in Dallas is 3,599. The number of specialists and practitioners in Dallas is 9,582, and the number of total practitioners 12,100. The effective discounts acute inpatient percentage rate in Dallas is 36%. The effective discount acute outpatient care percentage rate is 33%. The effective discount ancillary facility percentage rate is 49%. And the effective discount practitioner percentage rate is about 47%. What Paulick has hinted to in your favour, already priced into your quote, is Paulick coordinates 3 policies combined as one presentation, one quote, with one overall premium. Because the HSPIII is an indemnity plan, these other 2 policies are used to support the HSPIII where needed, such as outpatient benefits and cancer care. The second policy is an accident expense plan. Remember, the HSPIII policy always pays in addition to any other policy, such as the Enhanced Accident Expense Plan. So now you could have 2 policies contributing to the same accident claim, making sure that all bases are covered. Here is the benefit summary of the Enhanced Accident Expense Plan. We will focus on 2 units, for this is what is shown on most quotes. An accidental injury benefit could include any accident, such as a fall, burn, cut, broken leg, etc. As mentioned before, this plan enriches the outpatient benefit of the HSPIII. The plan will pay $4,000 per incident. Unlike the HSPIII, this plan will pay the exact amount of the claim. The difference will not be forwarded to the policyholder. If there is an accidental death with the primary policyholder, the plan will pay $100,000 to their beneficiary. For ground and air ambulance transportation in the case of an accident, the plan will pay $10,000. Again, this is in addition to the HSPIII ground and air transportation. Enriching the HSPIII outpatient policy benefits even stronger for accidents. If a person is confined in a hospital, the plan will pay $300 per day for 30 days. Major medical plans don't do this. The dismemberment benefits for the Enhanced Accident Expense Plan are: for the loss of a single finger or toe, the single benefit is $1,000, while the multiple loss benefit is $2,000. For the loss of a hand, arm, foot or leg, the single benefit is $10,000, while the multiple loss benefit is $20,000. For the loss of sight in an accident, the single benefit will pay $10,000, while the multiple loss benefit is $20,000. Now we move to the third policy, critical illness insurance, already included on your quotation. This policy complements the HSPIII in case of critical illness such as cancer, heart attack, stroke, and 8 other critical illnesses. This policy pays up to $50,000 in cash benefits if diagnosed with a critical illness. The cash benefit can be used for unexpected expenses associated with a critical illness, such as travel, food, transportation, babysitting, car payments, or just about any expense you can think of, including a vacation. This policy has dual categories. Therefore, if you receive a lifetime cash benefit of $50,000 in the cancer category, you may also receive an additional lifetime benefit of $50,000 in the heart attack and stroke category. This makes this benefit worth a total of $100,000. Paulick has added a number of additional benefits to enhance the HSPIII policy. Caris 360 is a concierge service designed to be your personal advocate. Their services are designed to assist you during each stage of your healthcare experience. This includes unlimited access to a dedicated team of professional advisors available by phone to assist you with healthcare-related questions. Caris has expert advisors to help you find the right doctor, healthcare facility, and obtain the best available pricing for procedures and lab tests. Caris will shop local and regional markets for healthcare facility options which include surgeons and specialists. Also, if your out-of-pocket expenditures are unexpectedly high, Caris will negotiate your medical bills to reduce these costs. Next, Paulick teamed up with Pram, a fully insured pharmaceutical drug card offering $400 per month of benefits to an individual and $800 per month to a family. This card has copays for generic as well as brand name drugs. When the Pram drug card is combined with the prescription drug indemnity benefit, your out-of-pocket expense is reduced and in some instances eliminated. This card gives great savings if you use prescriptions on a monthly basis. ScriptSave is an online discount prescription drug program. By using this benefit combined with PRAM, you will know the lowest cost and closest location of a prescription drug near you before purchasing. Finally, for those minor illnesses or common children's sicknesses, there's Teladoc. Teladoc is a convenient alternative to urgent care or ER visits. Teladoc has US board certified physicians who are available 24/7. Teladoc allows you to be diagnosed and order prescription drugs from the convenience of your home, thereby saving you time and the cost of a doctor's office visit. This is extremely convenient when dealing with children's illness and common colds or the flu. To learn how to look up doctors in the PHCS network, get a prescription drug card, or discounts on prescription drugs, check Healthcare Blue Book to review charges that are customary, usual, and reasonable. Then contact your broker if you have additional questions.